Hi, my name is Marissa Rodney, and my presentation is an introduction training to first aid and medical treatment. So, a little bit about myself. I am currently a senior at Southeastern Oklahoma State University. I am pursuing a Bachelor in Science in Occupational Safety and Health with a minor in psychology. Originally from the shores of Lake Superior in Wisconsin, I've lived the last 7 years in Enid, Oklahoma with my husband and our two dogs. The goal of this training is to provide critical information on how to properly respond to medical emergencies, while providing assistance to victims who are injured or ill before medical responders can arrive on scene. After this presentation, trainees should be able to assess scene safety to protect themselves and other responders, provide temporary medical assistance to victims as needed, and follow the universal precaution guidelines. Alright, getting started with first aid basics. In any situation, you can apply an action plan that's an acronym called the doctor's ABCD. What that stands for is danger, response, send for help, airway, breathing, CPR, defibrillation. While any of these steps are very important to an emergency situation, the most vital one is the first one, which is danger. Before responding to any situation, you must check the surrounding area for danger to yourself, others, and the victim. During a choking or airway obstruction emergency, the first step is getting the victim in a standing or sitting position. From there, stand slightly behind the victim, placing your arms around the victim's waist. Place your fists, thumb side in, against the victim's abdomen, slightly above the navel but below the rib margins. Grasp the fist with your other hand and exert a quick upward thrust. Repeat 5 times in a rapid succession. Repeat if necessary. For those who are CPR certified, this will be a brief refresher, and to those who have yet to take that training, this will be an introduction that will be further expanded on with your certification course. In a breathing emergency, the first step is to lay the victim flat on their back. Tilt their head back with one hand to open the airway while placing 2 fingers on the other hand under the chin. Clear the airway if necessary. Look, listen, and feel for respiratory movement for 5 seconds. If breathing is absent, pinch the victim's nostril, take a deep breath, and completely cover the victim's mouth. Give 2 slow, full breaths. Check for a carotid pulse in the neck and signs for breathing. If a pulse is present, continue rescue breathing at a rate of 1 strong breath every 5 seconds. Recheck for pulse and breathing every 12 seconds. If pulse is not present, begin CPR. Next, I will be showing a short film that I put together on CPR that highlights some of the key points to remember during a breathing emergency.
CPR, or cardiopulmonary resuscitation, is an emergency life-saving procedure, performed when the heart stops beating. There are roughly 350,000 resuscitation attempts outside hospitals each year in the United States, with 750,000 attempts in hospitals. For every minute that passes before resuscitation begins, survival odds decrease by 10%. Statistics show that immediate CPR doubles or even triples a victim's chance of survival. Specifically, studies have reported survival rates of approximately 10% to 12% when bystander CPR is administered, compared to 2% to 8% without it. High-quality CPR should be performed by anyone that is available and physically able to perform the CPR steps. There are 5 critical components of high-quality CPR. These include 1. Minimize interruptions in chest compressions. 2. Provide compressions of adequate rate and depth. 3. Avoid leaning on the victim between compressions. 4. Ensure proper hand placement. And lastly, number 5, avoid excessive ventilation. For healthcare providers and those trained, use conventional CPR with chest compressions and mouth-to-mouth breathing. Give 30 compressions followed by 2 breaths, repeat until first responders arrive. In adult victims of cardiac arrest, rescuers should aim to perform chest compressions at a depth of at least 2 inches and at a rate of 100 to 120 compressions per minute. Humming or singing songs with a tempo of 100 to 120 beats per minute can help you stay on rhythm while performing CPR. Songs that have the right tempo for staying on beat during CPR include Staying Alive by the Bee Gees, Just Dance by Lady Gaga, and Eye of the Tiger by Survivor. By scanning this QR code, individuals can access the Ultimate CPR playlist on Spotify. In the following clip, we will get to see a real-life health emergency where this pacing technique was applied to save a life.
To pump to the tune of Staying Alive by the Bee Gees.
In this hilarious scene from The Office, Steve Carell sings Staying Alive while performing CPR on a dummy.
You can't tell by the way I use my walk. I'm a woman's man, no time to talk.
Now the scene is being credited with saving a woman's life. Here's what happened. 21-year-old Chris Scott works at this tire and auto center in Tucson, Arizona. He's also a big fan of The Office. And yes, he has the same last name as Steve Carell's character, Michael Scott.
Staying alive, staying alive.
Chris was test driving a customer's car when he saw a car parked on the side of the road with its emergency lights on. An unconscious woman was in the driver's seat. She didn't have a pulse. I've never prepared myself for CPR in my life, he told the Arizona Daily Star newspaper. I had no idea what I was doing, but he did remember the scene from The Office. And experts say it's actually good advice. Staying Alive turns out to have the correct rhythm for chest compressions, 100 to 120 beats per minute.
Staying alive, staying alive.
Inside Edition producer Allison Hall tried hands-only CPR with Shane Woodall, president of New York City's Frontline Health.
Your live's got me looking so crazy right now.
It's not just Staying Alive. Plenty of other songs have the correct CPR rhythm, like Beyonce's Crazy in Love.
Dun 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 dun.
Even Darth Vader's theme from Star Wars.
Hands-only CPR is the CPR you give if you haven't been trained or if you're not comfortable putting your mouth on someone's mouth. And in that situation, singing Staying Alive or any of these other songs that are 100 to 120 beats per minute is very appropriate.
The woman who Chris Scott saved is now out of the hospital, all because of a CPR lesson courtesy of The Office.
Staying alive.
Nervous system emergencies include heart attack, stroke, and seizure. Treatment includes assessing the scene for safety, calling 911, getting an AED or first aid kit, and providing CPR or following the AED protocol. The AED protocol includes powering on the AED, attaching the electrode pads, shocking the person, and analyzing the rhythm. During an allergy emergency, call 911 immediately. See if they have an EpiPen and help them eject it into their thigh if needed. Try to keep the victim calm and help the person lie on their back. Raise their feet about 12 inches and cover them with a blanket. Turn them on their side if they're vomiting or bleeding, and make sure their clothing is loose enough to ensure that they can breathe. Hypothermia can result from cold exposure. Treatment includes moving the victim into a warm room as soon as possible. Be alert for breathing difficulties and start rescue breathing techniques if necessary. Remove wet or frozen clothing. Immediately rewarm victim by wrapping in warm blankets. Hyperthermia can result from the overexposure of heat. Treatment includes having the victim lay down in a cool, shaded area or an air-conditioned room while elevating their feet. Massage their legs towards their heart, and if the victim is conscious, you can give them cool water or electrolyte solution every 15 minutes until the victim recovers. Use caution letting the victim return back to normal activities even after recovered. The most important takeaway with wound care is making sure to take precautions before administering care. Always stop to put your gloves on and avoid contact with any bodily fluids as if they were infectious. Treatment for cuts and scrapes include cleaning the wound and the surrounding area with mild soap and rinse, applying pressure to help control the bleeding, covering to absorb fluids, and securing that covering. Treatment for splinters includes gently washing the area, using sterilized tweezers and needles to loosen the skin around the splinter, and using the tweezers or needle to pull the splinter from the skin. Cover the area with an adhesive bandage or pad if necessary. Broken bones and penetrating items are some of the more severe wounds that can happen, but hopefully some of the less likely to occur as well. With broken bones, it's important not to straighten the limb or try to return it back to a natural position. With penetrating objects, you shouldn't remove the object and you should try to immobilize it as much as possible. With both of these wounds, it's very possible that the victim might experience shock. Shock is a dangerous condition that can be fatal. Symptoms include weakness, feeling cold, having clammy skin, irregular breathing, nausea, unconsciousness, and a weak pulse. Treatment includes treating the cause of shock as quickly as possible, maintaining an open airway, and keeping the victim laying in a warm, flat area. Seeking medical help immediately is important, along with not administering anything by mouth. With burn treatment, it's important to know what degree of burn you are treating and what not to do. Do not clean burns or break blisters. Do not remove any clothing that sticks to the burn. Do not apply grease, ointment, or medication to a severe burn, and do not use cotton or material with loose fibers to cover burns. For a first-degree burn, it is recommended to apply a cool, wet cloth or immerse in cold water, but do not apply ice. With poisonings, if the person confirms an exposure or you find evidence of one, call poison control immediately at 1-800-222-1222. Call 911 if that person loses consciousness, loses control of their body, or has trouble breathing. Treatment for poisoning includes not giving any first aid if the victim is unconscious or having convulsions. Beginning rescue breathing techniques or CPR if necessary. If the victim is convulsing, protect from further injury, loosening clothing if possible. Induce vomiting if poison is known and is not a corrosive substance or petroleum problem. Take poison container with the victim to the hospital. Thank you for taking the time to watch my presentation on first aid and medical treatment.